Cases of coronavirus are rising on the continent. We've been given exclusive access to a coronavirus response team in Africa's most populous city, Lagos.
And they feel powerless.
It's one of our severe ones that we're paying very, very close attention to.
I was put as dead. I thought it was all over.
But on the streets outside this hospital, some people don't believe this pandemic is real.
Coronavirus is in abroad, not here. They are lying because I've never seen someone that have the coronavirus in this Nigeria.
It would have been funny if it wasn't so devastating.
Lagos, a bustling and vibrant state that 20 million people call home. It's now the epicenter of Nigeria's coronavirus battle. After a month-long curfew, restrictions are now being eased, but the virus shows no signs of slowing down. These are the doctors and nurses on the front lines. Dr. Iyohe Nakase is the team lead. He's worked in infectious disease for many years, treating illnesses endemic in the region like meningitis. But he says nothing compares to this.
I don't think anybody alive has ever seen anything like this before.
We're now on an isolation unit at the Lagos University Teaching Hospital. Anyone who tests positive for coronavirus is treated here. The patients on this ward vary in age. Some are in their 20s, others middle-aged, a handful are elderly. While some are gradually overcoming the worst symptoms of the virus, others still need oxygen to help them breathe.
How are you doing today, sir? Oh, okay, yeah. Let me check your oxygen levels, eh?
This man is 75, and like many hit hardest by the virus, he has pre-existing health conditions. He was at the hospital for a routine procedure when he collapsed. It turned out to be COVID.
If you see the 4-hour force, now people come carry me up. You will think they boom.
At least he's conscious now, he can talk and all that, but he's one of our severe ones that we're paying very, very close attention to.
Successive governments have been accused of underfunding healthcare here, and strikes are common. Last month, resident doctors protested the lack of protective equipment, hazard pay and poor welfare conditions. Medical staff are working long hours. Nigeria's hot and humid climate making the wearing of PPE particularly uncomfortable and exhausting. Staff are so busy they sleep in accommodation on hospital grounds, unable to see their families for weeks on end.
You're always, thinking, rolling back, thinking, okay, if we had this, or if we had done this differently, or if this person, if he had come earlier. But there's a sense also of anger. Why didn't he come earlier on? Why did he come so late?
One reason why people aren't going for testing or treatment in time is because there is a belief that the virus isn't real or that the scale is being exaggerated. Such rumours gained traction after this video was widely shared online.
This is the isolation center of Kano. Nobody is inside.
It claims to show an abandoned isolation centre with no patients. The government denounced the video, saying it was misleading, but many Nigerians are still sceptical.
Isolation center, people are dancing, eating, there's no corona. I saw it on YouTube now.
We did not see anything like coronavirus. Nigerians are it's real. But we have not seen anybody when they show you that coronavirus is real. You know that our government they are lying for us, especially Lagos state government, they are lying for us. All the state I went there, I see the people, the people there, they don't even reach their 300.
It's not real. They are using it to defraud the masses that we are already suffering. If corona is in Africa, in this vicinity, about 30 people are supposed to die to make me convinced.
There's a historical mistrust between some Nigerians and the government, meaning in addition to the belief the virus isn't real, many people aren't adhering to government advice on safety protocols. No one that we spoke to was wearing a face covering or a mask or was adhering to social distancing. These things are mandatory by the Lagos state government, and as the numbers continue to increase, things like this are a big concern. Much of the country's economy is informal. Lockdown measures were devastating for the millions of families relying on a daily wage. Nigerians are eager for things to return to normal, but not following safety advice makes it more and more difficult for medical personnel like Dr. Akase, for whom the pandemic is a daily reality.
This is not just among street people, ignorant people. You have seen this among educated people, people who are well-traveled. So it's an unfortunate sentiment, which I don't know if this is a global thing, but for us here it's a real problem. And I think this will complicate efforts to curb this in our country to a large degree. Sorry, lift your head. Lift your head.
Despite the disbelief outside, the suffering inside the wards is very real.
I was good as dead. I thought it was all over. Don't pray to have it.
This woman has lost her sister to complications stemming from COVID, and now both she and her nephews have been admitted with the virus. She's currently on oxygen, distressed because she's unable to bury her sister.
My sister is the closest sister I have in Lagos. She's gone. I've not buried her yet. Look at me with the two sons. We are here, admitted. I don't know why there's hope for me. I don't know.
I'm so sorry.
Patients spend weeks on the ward with the medical personnel and each other as their only company. Many staff carry the weight of what they see with them.
So when you're going home, you're thinking, okay, so this, should we have done this? Of course, then there are those that died, so you get to carry that with you, home really, yeah.
Until now, Africa has been behind the curve, but that's changing, and countries here are bracing themselves for when this pandemic reaches its peak.